And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey everybody, welcome to Keeping It 100, where we have these open and honest conversations about health topics that matter to our community. I'm your host, Dr. Kristen Ball Motley, and of course we have a good show, a super special show today. But during the show, you may think of questions, you may have comments, you may want to give us a shout out, say hi, let us know you're here, let us know you're with us. Pop it in the comments, and Dr. Tyan Thomas is behind the scenes. She will make sure your questions and comments are addressed. She'll show you some love out there in the chat. Let's bring in my wonderful, amazing, resourceful co-host, Mr. Georgie Mink Jr., aka the Street Practitioner.
Good afternoon. What's going on, Doc?
Hi, how you doing?
I'm good. Yeah,
Are the
good.
kids on their best behavior?
Yeah,
You've
yeah,
been
they
quiet
are.
this week. You ain't sent me no distress texts, kind of quiet.
We working on them. So
that's good.
We in the healing process.
That's a good thing. That's
right.
A good thing. All your work is coming to fruition. Like you're starting to see the fruits of your labor, right?
Yeah, I can honestly say that. I'm also still ready for the break. So yeah.
I mean, it's hard work. You out there in those schools, it is hard work.
I know how our teachers feel now. So shout out to the teachers and administrators and all that. Like, wow. So we're in the same family now.
Praise God for the teachers that are still teaching.
Yeah, how about that?
It's not, I mean, they have their own lives that they're trying to get through, and then they trying to help our children's lives and who bring all of our issues to school. Like it's a lot. It's a lot. Shout out to the teachers that are, that are still teaching, and shout out to the ones that said, this isn't for me right now. It's time for me to move on, because they couldn't bring their best self to our classrooms, and we appreciate that too. So it's tough. It's hard work. I know it is. And we are appreciative of the teachers. Thank y'all so much, so very much. That I ain't got to be sitting home with these kids every day, because Lord, I only got two.
It's okay.
They got a classroom full.
It's all right. Whitney said the children are our future. So
she did say that.
Yeah, she said that. So that's what we doing.
All right.
But I've been moving around, Doc. I've been moving around. I'm still out here. People still catching COVID. I mean,
COVID numbers are up. Now, I don't know anyone with COVID right now, but when I looked at the numbers last night, it is like shooting up like this way.
Yeah.
So COVID is, COVID ain't going nowhere. We know that. But the flu and RSV, we didn't know what to expect, but it's hitting us. A lot of people have the flu now. A lot of little kids, a lot of teenagers, college students. It's a whole lot of flu going around right now, for sure.
Right.
So everybody, just be cautious. I know a lot of places are recommending that people, they are starting to think about telling people to wear their masks again. I'm a kind of person, I don't need the government to tell me to wear a mask. I'm never going to stop wearing a mask ever in my whole life. So it's all good. But I feel like that decision is hard for governments to make, because it's like a political thing. Like they want to tell people to mask up, but they know as soon as they do, half of the constituents are going to fight against it and draw lawsuits, and it's going to be a big thing. So people, these viruses are going around, they spread when you're talking, they spread out of your mouth. So, and you catch it from it getting into your nose, into your mouth. So like just wear a mask. If you're like in crowded situations, like just do that to protect yourself and to protect those around you so that we can keep our families out of the hospital, especially around the holidays.
Right. Plus, it's about discipline. I mean, they shouldn't have to tell us now. We learned everything that we could about COVID and being vaccinated and how it protects us and the masks and all these other, like reasons to, that we can combat it or whatever. Washing our hands, the hand sanitizer. So, I mean, it's on you now. Like, I mean, that's basically, that's basically where I'm at with it. Like, we gave you everything you could have. So now it's time to be on your own. Handle your business. It's still serious, though. It's out here. The numbers are up. People still get sick. People still dying. I'm not sure of the rate at this time, since the numbers, since the CDC had lifted everything, but it's still around. So when COVID rides with the flu and RSV and all these other diseases and flus and the flu and all these other things that's going on. So you can play with your life if you want. So especially in large crowds, you should definitely have a mask.
Yeah, absolutely. Absolutely. We just want to remind everybody that the best way to protect yourself from COVID and the flu is to get vaccinated. We're always going to encourage you, as long as we know that the vaccines are safe and that they work. Now, as soon as some data come out that say otherwise, we're going to flip the script.
But we're going to tell you to go back.
We're going to keep it real. Call 1-800, call my lawyer.
Right. Right.
We're going to work on that too. But right now, everything is showing it works and it's safe. We have no other evidence to prove any other way. So, do what you can do and do what's best for you to protect yourself and your people.
Right.
But let's move into some health news update topics. This week, we're in December, and I didn't know this, but December is the month that has the highest rate of heart attacks. So Americans have about 800,000 heart attacks a year, and most of them happen in December. They're not really sure why. They say it could be because of the cold weather, but it's not cold everywhere in the country in December. So that is not, I don't think that that's driving it. They also said that people who have high blood pressure, high cholesterol, diabetes, who are already at risk of having a heart attack, they're doing stuff like eating foods that aren't the healthiest, like around the holiday season. They're not sleeping as much. They're stressed, and all these other factors can lead to having a higher chance of having a heart attack. They're drinking more alcohol, and we know that just causes damage to the organs. And so those are some of the reasons that may be why people have more heart attacks in December than in other months. Do you have any ideas about why that may happen, street practitioner?
I mean, you hit them all on the nose. I mean, we eat more, we plan big festive dinners, a lot of fatty foods. It's definitely more drinking around the holidays. The liquor stores are packed the day before the holiday. We make sure, we have our wine and spirits. We make sure we have plenty of food. And I mean, unfortunately, they're unhealthy choices. So I can actually see it. And then the stress goes along with the holiday as well. Stressing to get your presents and to shop and do all these other things. So I can see how everything can combine, can increase the heart rates.
Yep. Yeah. Absolutely. So we want to remind people, if you are feeling stress or discomfort, pain in your chest, that could be a sign of a heart attack. Any kind of lightheadedness, nausea, vomiting, that also could be a sign of a heart attack. Pain in your jaw, your arm, your neck, that kind of radiates, that could be a sign of a heart attack. Shortness of breath or difficulty breathing. So pay attention to yourself, pay attention to your body, and call 911. If you feel like something is just off, it's not wrong, and it's not explained, just call 911, be on the safe side. And I want to also remind you, for people that don't have insurance, because I know it's expensive to just call 911 and end up in the ER. If you don't have insurance, this is a good time. It's the perfect time to sign up for Obamacare. And tomorrow's the last day to sign up for coverage that starts on January 1st. So you can go to healthcare.gov to get on a plan for Obamacare. G, I'm not going to come at you right now about it because we don't have
Okay, because I was
time.
getting moved out
I
the
don't have
screen, but it's
time.
okay.
I don't have time for you and your foolishness
I was
today.
getting
So
ready to move out the screen. It's okay, Doc. Listen, listen. You said tomorrow's the last day.
G, I'm gonna go on to the next topic because I don't have
Okay.
time for you today.
All right. Okay. Okay.
Hey, Mr. Israel, thank you for hopping
Hey,
on and thanks for
what's going
checking
on?
out the show. So I also wanted to mention that Walgreens settled with the state of California for $500 million because the state attorney general claimed that they helped to fuel the opioid epidemic in California. So a federal judge had found that they had filled hundreds of thousands of suspicious prescriptions for opioids. They never looked into it, and those opioids were misused and caused a lot of people to become addicted. Apparently CVS is up next to pay up. So I'm just wondering, like, how do you feel about this, G, and what do you think that the state should spend the money on?
Well, I mean, the people that's addicted, I mean, obviously it was people, that had pretty much probably was addicted to opioids. And I mean, we know it's like a drug of the streets as well. So, I mean, it should go back to resources for helping people get clean.
Y'all heard the street practitioner, state of California. If y'all want to extend some contracts over here,
right,
we can help
fly
you.
out.
We can help with that mitigation plan on getting people into recovery, because it's
we could get a budget for it, Doc. They could give us a budget. We'll work with it.
Whatever budget y'all got, we can work with it.
Yeah,
but it is a process, and it definitely takes a village. And I see a comment about, isn't that the pharmacy just doing its job? So the pharmacy has a responsibility to fill prescriptions, but their case was they looked like they were suspicious. Now, I've been in the pharmacy where I saw prescriptions that the doctor's signature didn't look right, or like the date was weird, or like it just didn't look right. And you can choose to not fill the prescription. You say, I'm not going to fill this prescription. What the patients do is they go to another pharmacy, or they give you a hard time. So in my case, one time I was working in Georgia and they gave me a hard time, and I called the police because I can't have you in here treating me and my staff like you don't have no sense, and I don't feel safe. So then you wait for the police to come and they handle the business or whatever they do. I don't know. But the pharmacy doesn't have to fill every prescription that comes in, especially if they don't think it's a real valid prescription. So they should be scrutinizing it. But, it's just, it's not easy. It's not easy work. It's not easy work because you don't want to scrutinize everybody. And then you'll have a claim that you're just picking on me because I'm Black, or because I'm gay, or because whatever other reason. And that starts another issue. So you got to have a justified reason to scrutinize the prescriptions. But I don't know. Tyan, do you want to weigh in on this? I'm gonna back up.
Can she hear us?
She might be able to hear, but she might not be able to talk. I know she had a mic problem. Wait a minute, here she go.
Oh yeah.
Maybe not. All right. So Tanya, just stick your comment in the chat if you want, and then people can see what you think about pharmacies filling prescriptions that come in and supposed to just fill anything. But I think that is a interesting topic in terms of addiction, and it really leads us into our show for today. So I want to welcome Kiana Palmer, who is recovering from drug and alcohol abuse. She is 8 years sober, is what I'm told. So congratulations on that, 8 years sober. And she has a story to tell. We're going to hear that story today. So I'm really excited for that. Thanks, G, for inviting Kiana to the show. And Kiana,
that's my sister, man. Yeah.
Thank you
so much. I just found out we was related. Yeah.
Oh, wow. Cousin. Nice.
Yeah. It's always a pleasure. I want to say, thank you, George, for, the invite. And thank you, Dr. Motley. I believe someone on, I know Hi Pierre. I can't really see everybody. I can only see the three. I can just see y'all two and then myself. But when I was asked to, speak on this subject, I was excited. I'm like, all right, and I had the honor of speaking with George and sharing a little bit of my story, keeping it 100. I don't know no other way.
Right.
Yes, thank you.
I don't know no other way. So
It's important.
It is important. Mental health is important. Substance use is important. So it all coincides together.
It does. I was just going to ask you, if you don't mind, could you just start from the beginning and just share a little about, where this all started for you and how you got, and I mean, I don't want you to have to condense it into, because we don't have
a lot of time.
as much time as we're going to need to hear the breadth of your story, but I do want you to let us, but I do want you to share it, because I think people need to hear it. They will be healed and blessed by it. So we want to hear it.
Okay. All right. So I started this recovery. All right. So I first want to start by saying that I didn't realize that I had a problem prior to me picking up, and starting to use. And let me just say marijuana. Marijuana was the first time that I had ever used any type of drug or anything that altered me, right? But I'm learning through my process of recovery that it was because I was running from who I am, a self-identity, like identity crisis as a child. So some of these things stemmed up in my childhood. And as I become to grow into, 16, 17, when I was able to get out and interact with other children, this was like an outlet for me. So it was like something sociable, because everybody I hung around, they were into smoking weed, smoking cigarettes. This was their way of like being cool, and I wanted to be cool again, because I suffered from an identity crisis. I didn't know who I was, So I did that for a while. And as things arise, I found myself, when it was happy, when it was birthdays, when it was a sad day, if it rained outside, I'm talking about anything possible that gave me a reason to use a drug or smoke marijuana or drink a drink. I did that until I lost my son. When my 7-year-old son was murdered, that was like, it was something like very unimaginable, something I had no control over. But I did what I knew, and that was what? Pick up marijuana, drink. And at that point, people started to be around me. They started to come around me, to try to be of assistance, or console me. And I was introduced to cocaine from one of my mother's old friends. Yeah. So the week of my son's funeral. So then it progressed after that. That was like something I used to mask me. So now I'm not just dealing with this identity crisis. I'm dealing with death. I'm dealing with not understanding. I'm dealing with the fact I don't have my child anymore. So, I was dealing with a whole lot of other things. So yeah, that's where that stemmed in at.
Wow. I am so sorry to hear that. I am so sorry that an adult put you on to something that could be so destructive to your life at such a terrible time in your life. I am so sorry, Kiana, that has happened to you. I'm really just at a loss for words. Because wow, that's terrible. That is terrible.
Can I say something as it relates to that?
Please.
And I'm hoping that is that people don't. So let me say this. It doesn't matter if people take what I say and just hold it. because I'm at a place of freedom today.
Mhm.
So it doesn't matter where they take it and where they drop it off and who they send it to. It doesn't matter, right? I'm just hoping that it helps somebody, right?
Yeah.
Don't look at the fact that I use drugs. Don't look at the fact that I used to snort cocaine. Don't look at the fact that I was drinking alcohol. Look at the fact that it stemmed back from when I was a child growing up. That's where it
Right.
started in the
Right.
house,
That's where the behavior started.
right?
Right.
So, and I hear you say that, the fact that someone that my mom knew introduced me to that, but that's all they knew.
Yeah.
Right.
So
That's
all
true.
they did was
Right.
gave me something that helped them
That
get through
helped
what
them.
Yeah.
You're right. You are
right?
right.
Because it's all about how we look at things too. I
Yeah.
came up in an environment where as though, everybody was like family. I was a product of my environment.
Yep.
So the people around me that thought that they were helping me, they didn't know they were hurting me.
Yeah.
Let's
That's
hang
true.
out. Let's do this. Let's go take our liquor, because this is the things that I was doing prior to. So I used to look at it like that, like, oh yeah, they were coming to, they were coming to hurt me. No, they were coming to try to help me,
Yeah.
but they were just doing it in a form that they knew best how to. And that was, bring me cigarettes, bring me marijuana, bring
Yeah.
me alcohol, anything
Whatever.
that I was doing prior to that, what we consider to be sociable.
That's
Mhm.
that's a really good point. And I'm glad that you brought that point up. Because you said, it was your mom's friend. So why would your mom's friend want to bring harm to you? She wanted you to feel better, and she knew what made her feel better. And
Right.
so that's what she was sharing. That makes perfect sense. That makes perfect sense. Um, wow. So I want to talk a little bit about your path to recovery. Like, what has been most helpful in you to stay, to stay sober for so long?
So the question, because I'm streaming live on too, but I'm giving attention to y'all, right? Because a lot of people always ask me, Kiana, could you share your story? Could you? So that's why I'm trying to stay focused on both. But so the question is, how did I stay sober so long? So I was court stipulated into this process, right? Because where I came from, I didn't see that I had a problem,
Right.
right? I just seen that I had found a way to mask my feelings, right? I felt the way I felt drugs. I felt like, like using something made me feel some type of way. But I was court stipulated into this process. I had got 2 DUIs I was fighting, one in Delaware County and one that left me on life support.
Mm.
Yeah, so that's a whole other story. But
Yeah.
I'm here. So after that, when I went back to court that second time in Philadelphia, because I'm so used to like people being so lenient, and Delaware County judge was just like, shout out to Clinton. It was just like, oh, go ahead, like we're gonna. But Philadelphia was like, nah, you going to jail. Like
Wow.
you fought this for a year and you going to jail. And actually, I had smoked marijuana that day before I went to court.
Mm.
Because I didn't think, I thought that they was just
Yeah.
going to give me a little pat on the back because that's what's just been happening, But unfortunately, they didn't. I was sentenced to 18 to 36 months at State Road. God intervened. I only did 90 days
Wow.
with the release to a recovery house,
Mm-hmm.
which I had discovered in court that day. Somebody had told me, yo, tell them that you got a drug problem. And at this point, I just wanted to listen. I didn't want to go to jail. So I'm talking about when you're caught up in a lifestyle of addiction, you don't care. You're so selfless. You don't care about you first. You don't care about your kids. You don't care about the family. You don't care about the harm that you actually put on other people, right? And I'm gonna say that it wasn't like it was intentional. It's just that again, I started at 16. So now from 16, I didn't even start telling you a lot of other things that I experienced in life that caused me to keep continuing. So now we talk about 25 years old, losing a child, going through all this, being homeless, everything that I had went through in and out of relationships. I didn't know nothing about a relationship. Don't ask me to relate to nothing because all I know is I don't have control of it. It ain't relating to me.
Mm-hmm.
So, however, then I got sent to Gaudenzia. And in Gaudenzia, I went through a process of they had programs put in place like parenting classes, and because it was court stipulated. If it had not been court stipulated, I would not be sitting here today, because I'm a type of person, I want to do what I want, because that's what all I did.
Yeah.
I did what I wanted, not what I was worthy of, but what I wanted. Right. So I just stayed in the process. I went to IOP because they told me to. But in that process, I started to love me because other people started to love me. Like, other people started to believe in me. They started offering me positions at the program, like, yo, like, we think you see fit for this. And I'm like, me? Oh, all right. Well, just tell me what to do.
Mm-hmm.
And, and I just did that, and I stayed connected. But the most important thing that I can say to anybody that's listening to Keep It 100 podcast, or that's following me on, on social media, I found that I was afraid to face life on its terms.
Mm-hmm.
And I think that that's the most important thing in life, when you start to get in tune to who you are, like the real core of who you are. I'm talking about stripping yourself from everything, because that's what happens. And I don't know if nobody know about going into recovery, but when you go into recovery or in prison, like, you strip everything. You take your hair off, you take your eyelashes off, anything that ain't yours, it's coming off. And you in there, you doing your time, I can't put on front for nobody now. I can't be all these different people, or no, I just was who I was. And I began to love me. And I began to, work on my son, me and a relationship with my son. I did therapy. Therapy is a very big part of my recovery and my self-development, because I had to do that. That was essential. People had this stigma, like myself. When I heard people tell me, get help for losing your son, I'm like, get help for losing my son? Like, no, you crazy. Like, I ain't crazy. Like, because that's the stigma I had on it. Even when it came to drugs, like, I could smoke weed, I could drink. Like, cocaine to me was like an addict, like a person, like a dope thing, like somebody on the street that's just sitting there that's looking hopeless. Like, I didn't know, like, snorting a little coke here and there when I'm drinking. Like, nah, you ain't no different from them, sis.
Right.
You ain't no different from them. And that's what we get confused about. We want to look at, the difference instead of the similarities. Like, if you doing something that you see somebody else doing that's causing them to lose things in life, you better check yourself.
Yeah.
You may not lose it how they lose it, but you on the road to losing some stuff.
Yeah, pretty much. Wow, that's heavy stuff. I'm going to start calling you the story. You know what I'm talking about?
I'm here by God's grace.
That's the name of your book.
Amen.
Yeah, I'm here by God's grace.
Amen. I'm really glad to hear that you went to therapy and that you went to recovery. That you were forced to go to recovery, and it's helped, because people go in and out of recovery for years and years and years. And I'm really glad to hear that it was the thing that changed for you. Right. So I want to bring in therapist Danae Fobish. She is the founder and of Discovery Me Therapy. She helps individuals, people, and couples struggle with relationship issues, mental health conditions, and substance and alcohol abuse. So let's bring in Danae so she can talk a little bit about what you experienced, and we can, just have a conversation around that. I think she's still on. Let's see. I don't see her coming in. Let me see if she's in the chat. Danae, can you hear her? Up there she is. Welcome to the show.
Hey, how you doing?
I just want to thank you, Kiana, for your beautiful story. And I am just, girl, you just filled my heart this morning. I love recovery so much. And I love when people are so adamant about sharing their recovery story. It is so necessary. It's so needed, not only for you, but for every single person that's hearing this. Because like you said, one of the most powerful things that you said is alcohol, addiction, substance abuse, all of that is no different from the person who's on the corner. Yeah. It's no different. Just because you're behind closed doors, just because you have a job, if you are sinking and hurting and self-medicating, you got a problem.
Mm-hmm.
Yeah.
And I'm just so excited to be here. So thank you.
I'm excited to be here too.
Yeah. So, Danae, I wanted just to start off when we talked earlier this week about the show. The first thing you said to me was alcohol is a drug, because I was talking about drug abuse and alcohol abuse, and you was like, wait, alcohol is a drug. So I wanted you to share with the listeners about that a little bit.
Yeah, I think it's important to consider that alcohol, we celebrate alcohol use as a country, and especially within, our community, right?
There you go.
Grieving, if something is happening, or if we
We can't. I think it's better now.
Oh, okay.
Yeah.
Okay, cool. But yeah, so we use it, and sometimes we can minimize the fact that alcohol is so powerful, right?
Mm-hmm.
Every time that you toast, every time that you drink just to have a little good time or whatever the case may be, you're still putting a substance in your body. It's addictive, and it's progressive, right? And so I think what's most important is to consider, what is your relationship with alcohol use, right? Why are you drinking it, and when are you drinking it? Because if you are drinking it when you are in pain and you're suffering and you're trying to escape, then we need to seek some help, right? But every person that has a substance or alcohol abuse, it started from just casual use, right? Having a little celebration, relating to somebody, building community, having relationships, right? It started for something that was harmless. And responsible drinkers do become alcoholics. They're not exempt. You're not exempt from addiction if you choose to partake. So I think it's important to be mindful of, what is your relationship to alcohol, especially during this time of the year.
And looking at when you use it, kind of like Kiana was saying, it was helpful for her to get through the challenges that she was having in her life by using these different substances. And so I guess I'm wondering, like, how can people know when they are getting, I don't know, close to becoming addicted? I don't know if that's a thing, like close to addiction, or how do they know when it's time to start asking for help?
It's always a time to start asking for help, right? Our community doesn't know how to ask for help. We feel like we should be able to do everything on our own, and that's where the problem exists.
Wow.
If you are drinking or using because you feel stuck in any type of distress, whether it's sadness, depression, whatever is happening in your life, and you're having a hard time coping with it, you need to talk to somebody. Don't let it become a problem, right? It doesn't have to be catastrophic in order for it to be a problem.
That's a really
because I was going to go ahead.
So what about the drinker that after a long day's work, a hard day's work, and we would settle with a wine, a glass of wine, or a happy hour? Because I'm like a happy hour guy. Like, I mean, I got a stressful job, and every now and then I might want to get with my coworkers and just go to a happy hour. I mean, they call it happy hour, so I'll be going, trying to enjoy that hour. But I mean, so I know that's a form of addiction, but I feel like it's different kinds. Like, that's controlled addiction. So some people, it starts getting like it's a fine line between it. Like, it's still addictive, but you feel like it's a controlled addiction because, you basically in control, but you just never know when it's going to spiral out.
Absolutely.
Right.
And so my question would be, do you have other means of coping with stress, right? If your only means of relaxing is to have a drink, then we got to ask ourselves, what is in your toolbox to cope? Right?
Wow. Okay. Wow.
I just want to say something. I noticed from working with children, that, and because we're parents and we got busy lives, that usually, and I'm working out of a school in Philadelphia, and they look at the children's behavior. So anything that a person does, it'll show itself through its behavior, right? So even a person, like, you can lie and say, I'm gonna say recovery because this is the topic. You can lie and say, oh, I'm in recovery and I have years. It doesn't matter what comes from here. What matters is the behaviors, right? Because I can tell you all day I love you, but then hurt you with my actions.
Mm-hmm.
So what I found that, and I don't assess, I don't diagnose, I don't do any of that. I am in school right now, but that's not what I do now. I'm there in that school to be a support, and that school actually helps me at home as well. So what I found that from my own personal experience, from me not getting that nurturing that I wanted, me not getting that attention that I wanted, me not getting that, that one-on-one, seeing that diversion with my mother and father not being together, like all those things came into factor. And that's where it begun at. These kids, these children are children, right? Because I never want to set myself outside like I used to do. That's another thing I used to do. I always used to look at everybody. Our children as a whole need us to be attentive to them. I mean, even just taking that 1 second. I know it's busy. You in a phone conversation and you take that time and tell the person on the phone, wait a minute, hold on. I got to call you back. Let me see what's going on. Because we find ourselves shutting our children down. We shelter them. As men, I hear a lot of the young guys, at school say how, remember when you would get hit as a child, the boy, you would punch a boy and they go to cry and you be like, shut up. What you crying for? You acting like a little, No, you're telling him that he can't use what God gave him. That's an emotion.
Absolutely.
So now, because this is a doctrine, this is something that this young man has been taught, he can't relate to his emotions. He's disconnected. So now he's at an adolescence point. Now somebody then disrespected him or, had him come out of character. And the only form, because of his environment and what he's seeing, the people here around, you let that boy talk to you like that? Yeah, take this. Now you got a gun. Now you got a murder. So it starts from a child. I'm telling you, it starts from being a child. Now listen. I'm not the perfect mother. I haven't been the perfect mother, but because I put a drug down and I started to get in tune with myself and God started to work on me, I'm starting to do better in my home. I'm at PTO meetings. I was just asked, tomorrow I speak at my son's school. I had to ask him, like, do you feel okay about that? Because they reached out to me.
That's great.
And I don't really. So what I'm going to do is I am going to be there. I'm not going to speak. I got somebody else that's going to speak on behalf of for the youth, But my point of saying that is just me just showing up, just me and just being involved, even with my 5-year-old. She can read at 5. I wish somebody, my Aunt Diane used to read to me. I had an aunt that used to read to me. So, but I wish that I had somebody that, could give me the things, that I'm able to give to my child. But it all happened. It's never too late. It all happened because of one thing, me putting down a drug and stop being selfish and being selfless. So now this goes first, my home, my God, my recovery, my home, and then everybody else.
You just dropped the mic.
Yeah, that's heavy.
She's a mic dropper right there.
Oh, she's a mic dropper. Oh,
That was definitely a mic dropper. As we start to run and close to closing out the show, I do want to ask Danae to share, to supplement what Kiana said in terms of what helped her the most into getting into recovery was a treatment center. And so could you share
and a therapist
strategies?
A therapist had to walk me back to that little girl stage. Yeah.
Okay. All right. So we start with the therapist then. I wanted Danae to supplement that? Like, what other strategies can people use, or is that the thing? You start with a therapist.
Well, I think it doesn't hurt whatever avenue you take. If you feel safe with somebody to disclose whatever is happening, anybody can be a means of support.
Yes.
Right. So even if it's calling into a crisis line, even if it's, it's your grandma and you like, all I need you to do is call the hospital, make me an appointment, take me to the ER, whatever, whoever you can entrust that you are in a vulnerable situation and you need additional help. There's plenty of resources. You can go online. You can go, the emergency room is always the first line of defense, right? When in doubt, go to the emergency room. But of course, we can't always get to an emergency room. So if you have insurance, you can call your insurance. A lot of insurance have therapists available for crisis situations, and they'll point you in the right direction in terms of your coverage, right? You could also call a crisis line, and you can find out what's in your local area to get you the support and assistance that you need. But, the more you isolate yourself, the more harm you're doing to yourself. Reach out for support. And if that person don't know what to do, you tell them what to do. Call somebody who can. Therapy is awesome. And I love that Kiana said that she was manipulated into this, right? A lot of times we think negatively about the court system, how they deal with addiction, and usually it's punitive, right? But those are interventions, right? They're interventions to get people back on track. So if you've been, caught with a certain amount of marijuana on you, or that you got a DUI, it's an opportunity to intervene on that person's behalf, because like what you emphasize is you never know that you have a problem.
Yeah, you don't.
Something happens. For some people, they never get help until they hit rock bottom, right? And it's awful. You don't necessarily have to hit rock bottom to get help. And that's really what I would want you to know is what's in your toolbox? Who can support you? More supports. Look for the resources.
Thank you for that. There was a question that came up in the chat, and I did want to address it. This is for you, Danae. What about, and this is when we were talking about drinking and what counts as being addicted. And the question is, what about people who drink socially just to feel the buzz?
Yes. So addiction is it's like the dependency, right? There's a difference between abuse versus dependency. Abuse is what does your relationship with alcohol look like? Are you using it to be social? Are you using it to not feel the pain that you feel each day of whatever traumatic event that you haven't addressed, right? If you're grieving and your way of grieving is by drinking, that is a harmful relationship with alcohol, right? So again, you need to ask yourself, what are your means of coping? If alcohol or substances is your means of coping, it's a problem. It doesn't matter how many drinks, it doesn't matter how many puffs, it doesn't matter the amount, whatever, none of that matters. It matters what is your relationship. If you don't have any other means of coping, now addiction is, I have to go back. I can't stop. Once I pick up, I can't stop. It's a part of my life. It's a part of my everyday function, right? That's full-blown dependency. I wake up, I need a drink, or I need to smoke. I can't talk to y'all until I have not my coffee, but my first dose. Right?
Wow. We could go on with this forever, Doc.
Yeah. I'm just sitting here. Listen, I'm sitting here because, like I said, I'm learning more and more, about the disease of addiction, because it's actually a disease. And I don't want nobody to be confused and think it's just about a drug. No, it could be sex. It could be watching porn. It could be exercising. It could be, it could be anything that you find yourself that you don't have control over.
Right.
And sometimes you don't realize you don't have control over until you hit rock bottom. But don't be confused about rock bottom, because there's some good things that you're going to learn when you hit rock bottom.
Yeah.
you know. So that's where the pride falls off at, you know. So
You about
We
to
gonna-
jump
we need
that
her
mic. I
back,
know you
Doc.
want to be like Trump,
Hey,
jump
Doc,
and
we need sister back.
Well, let's wrap up. Danae, thank you for sharing your professional expertise with the audience. Thanks for your time today. Danae is joining us from Virginia, y'all. So she's not in the area, but she's still helping our people in this area. So thank you for that. And Kiana, Key, thank you.
We bonded. That's okay.
Thank you
I'm
all.
gonna call you later, girl.
That's not a problem.
Keep
That's not a problem.
doing your work.
Right fast before y'all let us go. If anybody that's on this live or on Keep It 100 podcast, and if you want to get your children into any type of get them assessed or get them a therapist, the back of your medical card. Call the back of your medical card. It's a 188 number on there. Listen, my child has this. This is what's going on. Let them be active. Have a conversation with them, and it'll start right there.
Wow.
Absolutely. And we also want to plug, if you don't have insurance, you can also reach out to your local crisis center. So all the hospitals, like all the counties around the country have a crisis center, and you can contact the local crisis center if you don't have insurance.
If you live in Philadelphia, contact me. If you live in Philadelphia, I can get you some treatment if you don't have insurance, or go to Healthy Mom Philly. And you can get assessment done there too.
Healthy Mom Philly.
Okay,
Healthy Minds Philly.
Healthy Minds Philly. All right. So Healthy Minds Philly is a resource for people that live in Philadelphia. Thanks so much, Kiana. This was really, really, really good.
Okay.
So
I'm
good.
grateful for you, girl, and good luck and best wishes. And I just see real big things happening, continuing to happen for you. So congratulations.
Thank y'all so much. Thanks for having me.
And happy holidays, everybody.
Happy holidays to y'all as well.
All right, sis. I'll talk to you later. All right, Doc.
Okay.
All right. Thank you, Danae.
Thank you.